Hello everyone, I'm here to share great news about the Prime Employee Health Plan. There's no change in your benefits, but they're now easier to use. In the next 15 minutes, you'll see everything you need to know to get the most from your health benefits. Prime is known for the high-quality, compassionate care we provide to our patients. Prime is honored to bring that same care to our employees as part of the Prime family. When you get to know your employee health benefits better, it's easier to use them. We simplified what you need to know and put it all together in one place. You can also reference this presentation later. It's available online at primehealthcare.com/EHP. This presentation is about how to use your benefits. What your benefits cover has not changed. For information about your specific medical benefits, please consult the materials provided to you when you signed up for the Prime EPO plan. Let's start with a brief overview. Prime offers one of the nation's best employer health plans. We fund the plan and take on the cost of benefits. That means Prime is your health insurer and we can provide excellent value. Prime keeps the cost to employees low by paying up to 90% of the monthly premium. And for 2022, we will not increase your monthly premium despite rising healthcare costs. Your employee health plan is powered by Prime with all the resources of a leading national health system known for the quality and compassion delivered by its people. We stretch from coast to coast, serving more than 2.6 million patients each year, including nearly all Prime employees. The Prime EHP offers 3 medical benefit choices, as you see here. One of them is right for you. The Prime EPO, the plan chosen by 97% of our employees, covers preventive care and the cost of most inpatient and outpatient hospital services at 100%. Members don't have to pay anything for care besides the usual premium and copays, which are low. The second choice is for employees who are already covered under another employer-sponsored health plan. The MERP, or Medical Expense Reimbursement Plan, pays all the copays and deductibles the member incurs under their other health plan. Finally, the Value Plan covers all the essential benefits spelled out in the Affordable Care Act. It's more expensive than the Prime EPO because it offers more choices for care. Because nearly all employees choose the Prime EPO, our discussion will center there. The Prime EPO is composed of networks of providers who deliver medical services to EPO members. Tier 1 is the heart of the EPO. It consists of Prime's own medical groups, hospitals, and facilities, as well as independent providers, medical groups, and facilities contracted under our Tier 1 EPO network. Your benefits and costs depend on where you receive medical services within Tier 1. Benefits are highest and costs are lowest when we refer first to Prime Medical Group's hospitals and facilities. Then, when needed, we refer to EPO contracted providers, medical groups, and facilities. When you stay within Prime Tier 1 for services, you do not need to get approval before getting care. This means you can get most care during an office visit to your PCP or specialist without waiting for prior approval. The same applies for many preventive screenings and a long list of auto-approved services. That's the beauty of Tier 1. Prime EPO serves members across the country in many different communities. Where you receive care within Tier 1 may vary based on the availability of Prime-employed providers and Prime-owned facilities. In communities with fewer Prime providers, hospitals, and facilities, members may receive more care from EPO contracted providers. In the example shown, your PCP may be a contracted provider, but your benefits are still covered under your EPO plan. When you receive services in Tier 1, you get the highest level of benefits at the lowest cost. You have 100% coverage for most care with low out-of-pocket costs. There is no annual deductible and no approval required for PCP visits. If you get lab services, X-rays, or MRIs at Prime facilities, you don't need prior authorization and your cost is minimal. If the service you need is not available in Tier 1, your provider will refer you to Tier 2. This network of Blue Shield or Blue Card providers is contracted by the Prime EPO to provide services to our members. Your costs, such as copays and deductibles, are higher, and you must receive prior authorization before you receive services. Important to note, if you do not follow Prime authorization requirements, you may need to pay for medical services. Not to worry, this presentation will clearly show you how to meet those requirements. When some services are not available in Tier 1, 1.5 benefits allow you to receive Tier 2 services at Tier 1 rates, saving you money. 1.5 benefits require prior approval before you get services, and they do not apply to all kinds of care. You can learn more about 1.5 benefits in the summary plan description you receive when you sign up for Prime EPO, or you can call customer service. Now let's move on to the next topic, member ID cards. The front provides all the usual information. It identifies that you are enrolled in an EPO employee medical plan that may require prior authorizations. Please be sure your providers know this. The card shows a PPO logo, which may create confusion. The back of your card has plenty of helpful information, including plan requirements and contact numbers for service. All this information is as close as your ID card. Keep it handy. Now let's talk about your medical care. It starts with your PCP, who takes care of you and manages your care. If you need to find a PCP, you can go online to the Find a Provider tool on your local Prime Hospital website. If you already have a PCP, check the online provider directory to make sure they are in Tier 1. Finally, if you already have a PCP who isn't in Tier 1, you can invite them to join. If you would like more detailed information on how to get medical care through your Prime EPO, please consult this step-by-step guide. Some of you may need continuation of care if you are joining the plan or changing providers. It allows you to stay with your previous provider if you need critical care with continuity, such as being in your 3rd trimester of pregnancy or being scheduled for surgery within 90 days. Prior authorization is required. Please ask your provider for details. Now let's talk about authorizations. Our new online tool enables Prime providers to instantly approve 60% of required authorizations. And as you can see, up to 98% of all authorizations get approved, with 92% of them approved within 24 hours. Claims processing is speedy too. Whenever prior authorization is required, you need to get approval before you go for services, even if the need is urgent. If you have an urgent medical need, call customer service for immediate assistance so you can request urgent approval for that prior authorization. Let's look step by step at how you can meet authorization requirements. 1. Always contact your PCP or provider when you need medical care. 2. If you need a prior authorization, be sure it is approved before you go for care. 3. Go to the network provider where your PCP or provider sends you. And 4. Always contact customer service if you're not sure what to do. That's the basics. Now for the details. They're summarized in two charts, one for services from PCPs and specialists, and the other for services from facilities. Here's how to read the authorization charts. First, get to know the definitions at the top of the chart. Then, check the color codes that tell you whether authorization is required. Pink means that the services do not require authorization. Blue means you must have an approved authorization. After that, go to the column for your kind of provider, either employed or contracted, Tier 1 or Tier 2. Finally, check the blocks for numbers that indicate footnotes below and read the details. Here are the footnotes referenced in the previous chart. They are enlarged and explained so you can more easily follow what they ask you to do. Please take time to review them later. Here's the second chart and its footnotes. Note the amount of blue. It indicates more services require authorization. Please be sure to reference these charts before you go for care. The full charts are included later in this presentation and are available on the EHP website. Prime makes extra effort to explain the prior authorization requirements because we want you to get the full value of your benefits and to avoid paying for services covered fully under your plan. Please be sure to know and follow prior authorization requirements. Sometimes you may not agree with benefit decisions. You may appeal them by following the process outlined on this slide. Member appeal requests must be submitted in writing to Keenan, your plan's benefit manager, within 180 calendar days of when the questioned decision was made. No one likes to receive a bill when they believe everything is paid for, especially if it's for your medical services. This is known as balance billing. Balance billing happens when a member receives a bill from a provider after they believe everything has been paid for under their plan. These bills are sent by providers in the EPL plan and not by Prime. We work to protect our members from balance billing and will help you if we can. But please know that if you do not follow the requirements set forth by Prime in your plan, we won't be able to help you and you may be responsible for payment. To avoid balance billing, you should get to know your plan well and use it properly. Make sure you tell providers that you're in an EPO plan and must follow its requirements. And be sure you receive services in the Prime Tier 1 network, which are covered under your plan. Last, but far from least, is customer service. Knowing who to call makes it easier to get the help you need. Your EPL plan is serviced by Prime as your benefits plan, Keenan as your benefits manager, and Express Scripts as your pharmacy benefits manager. This slide has a summary of the contact information and the services they provide. More specifically, here's an expanded list of customer service contacts for a wide range of topics. Keep it handy for reference for when you need information or help. We're just about 14 minutes into our presentation, and we've covered everything we set out to discuss. Now it's time for Q&A. If this is a live or virtual presentation, please ask any questions you may have. If you're looking at this presentation on your own or have questions later, please reference the customer contact numbers to call up and get answers. One question that you should remember, because it's very important, is to always ask, are the medical services I need covered under my EPO plan? Ask your provider before you get the care.